people give less importance to physical exercise. They are more occupied with their work and their family. So exercise, fitness, they take a backseat. If I go for running, my knees will hurt or my knees will get damaged. If I go to gym, my back will get damaged. So this is just an excuse to avoid activity. So there is no age which is too old for physical activity. So running, in fact, it's good for the back muscles. It improves the strength of the back muscles, it improves the endurance, it improves the tone of the muscles.
People come to you after doing Google or Chat GPT about their back pain, and how commonly you see that thing, and does it really help them?
One habit which really harms the back is smoking. What smoking does...
How exactly smoking affects the back? Hello and welcome to my podcast, The Healing Monk. I am Dr. Suman Das, your host. Thank you very much for liking and appreciating our previous episode with Dr. Maithili. If you find value in this podcast, please do subscribe and share it with your friends and families. Today, we are going to discuss about something which becomes a very, very integral part of our life, or a common problem that everyone faces, especially when we are in the age of 40 to 50. That is back pain. There would be no person who has never had back pain. It starts with a simple reason for which we bow down, just like tying our shoelace, and that's when our body or our back says, buddy, I am on leave today. Today, in our episode, we are going to discuss about what exactly causes the back pain. Can we avoid back pain? What are the red flags that we should take care, whether we should do certain kind of interventions like medications, or the back pain can be relieved with certain change in our habits. I have with me a eminent orthopedic surgeon who deals with bone and spine. He is not only an orthopedic surgeon, he is also an endurance athlete who has undergone a lot of injuries and has recovered over the period of time. So he is the best person to tell us as how we can avoid having back pain, or if we are having back pain, what exactly we should do. I have with me Dr. B. Leela Prasad, an eminent ortho and spine surgeon of Visakhapatnam. Hi Leela.
Hi, Suman. Hi.
So we are talking about back pain. Do you see this very commonly?
Of course, it is the most common symptom in my clinic.
Why people have this as a problem, and what is the common age they present?
See, as you rightly said, there must be no patient or no person who had never had back pain in his life. Okay, and back pain can occur at any age, though it is slightly rare in children and adolescents. The most common is adults, middle age, and elderly.
Middle age in the sense?
Middle age in the sense after 40 years. So after 40, the incidence of back pain rises.
So do you think the reason why it is commonly occurring in the age of 40 is because of we get old, or our muscles get weak, or what exactly is the cause of 40s and 50s having the back pain as the most common complaint?
Yeah, most commonly, see, once you say in your middle age, people give less importance to physical exercise. They are more occupied with their work and their family. So exercise, fitness, they take a backseat. So obviously your your back muscle strength comes down, and they may indulge in activities which they were not regularly doing. So occasionally, some one fine day, they start going to a gym, which they were not accustomed to. So they're doing these unaccustomed things, and muscle weakness, poor posture, all these are causes of back pain.
So what exactly you will call unaccustomed? Let us say something, friends are calling for a badminton match, and we just go and play badminton match. So that is, we cause a muscle sprain.
Exactly.
Do you see it more common in the new year after people's new year?
Yes, exactly. So people start going to the gym after the new year, and many people come with back pain after that.
So, as you're talking about gym, many people go for physical exercises, especially gym or open air gym or something like that. Do you feel that doing the exercises without a proper guidance or without a proper kind of training or a trainer is a major cause of back pain, and it really hurts?
Lack of proper supervision, lack of proper training is one of the cause, and also people, they feel that they want to get fit in one single day. So all of a sudden they start doing everything. So when you go to gym, there's a method in it. So you should gradually escalate your duration of exercise, or you should gradually escalate the weights. What people do is they try to do everything in one day. So that is the major problem.
So our body gets old, but our mind is still in their 30s. And that is when we go and we start trying to do some exercise, and we end up in doing something unaccustomed exercise.
Yeah, not exactly old. 40 is not old. But then you have stopped activity for a few years. So your body loses the conditioning. And once you start suddenly, then it can't take up the stress. So whenever you start exercise or activity, better take it on a gradual basis under a proper supervision.
So you are a runner, you have done so many marathons. So how do you think that people in their 30s or 40s or even 50s, they get into the physical activities like running or let us say cycling?
See, there is a very popular misconception, or rather people use it as an exercise. So that if I go for running, my knees will hurt or my knees will get damaged. If I go to gym, my back will get damaged. So this is just an excuse to avoid activity. So there is no age which is too old for physical activity. People, they damage their health without activity. No one has damaged his health with physical activity. So physical activity is always good. But the only thing is you should start in a proper way. And more importantly, unless you realize that physical activity is important for you, people don't do the exercise themselves. So no matter how many lectures you give them, or how many social media videos they see, and how many motivation talks you give them, they don't really do it. They start doing it only when they personally feel that exercise is important for me, exercise is going to change my life. That is the point when people start exercising.
So in fact, the very nice thing that you told about running, how to start running. In fact, people ask me how to start running. I always tell them, you run for 100 meter, walk for 500 meter.
Correct.
Then again, run for 100 meter. Gradually, the sequence will change. You run for 500 meter and walk for 100 meter. Commonly, the problem that we see is that whenever someone sees us running, they say that don't run, you will get back pain. Or many a times it has also happened, I have seen people have started running by seeing me. After 2 or 3 days, they stop it, saying that I am having back pain. Do you see this kind of patients at your clinic?
No, actually it's the reverse. See, initially when I was doing long surgeries, I used to get a sort of ache in my back. So after I started running, so even if I operate for long hours, 6-7 hours, I don't feel any pain. So running, in fact, it's good for the back muscles. So it improves the strength of the back muscles, it improves the endurance, so it improves the tone of the muscles. So running is always good for the muscles. So if anyone complains of pain after running, that's probably because he has never run earlier, or he has run too much. So that pain will anyway go away if he continues running.
So which you told like unaccustomed exercise.
So back pain is not a reason to stop exercise.
So when you see a patient of back pain, okay, they come to your clinic, what common psychology you face, like the patient psychology? Like they think that they are having a big issue, they are having a spine problem. Because commonly, as I told in the introduction, like we call it, there is a vicious cycle. We go into a denial phase. We don't accept that this is a problem. We go on changing doctors. We go on taking scans. So what commonly psychology of the patient that you see?
So usually when patient comes to doctor, it means that he has had pain for quite a few days, or the pain is severe. then only usually they come to a doctor. And they're usually worried that something is wrong. So once you examine them or once you physically examine them, and if you tell them there's nothing wrong in the back, they are really relieved. So most patients who come to a doctor, they have a thought that something is wrong in the back.
So let us say when you examine the patient, a patient comes with a complaint of back pain. So when do you think, or what are the common signs and symptoms that our viewers can understand that these are the red flags that this back pain what I am having is really a problematic thing?
Yeah. Most back pains are innocuous. They're not really dangerous. So the best symptom, the indication for that is if any pain which is more on physical activity, and if it comes down with rest or if it comes down during sleep, that is mechanical pain and there's nothing to worry about it. But if you are having pain for more than say a few days or maybe a week or two, or if the pain is very severe that you are not able to do your routine activities, like say taking a bath, walking around in the house, if even such small activities are painful, then there could be something wrong in the back.
So in simple terms, if we have a back pain which gets relieved with simple rest, we should not bother about it. If we have a pain which is radiating to the leg,
yes,
which restricts our movement of the leg, then there could be a pain, there could be something in the spine or some slip disc or something like some disease there in the spine. So these are the things that we should always take care.
Yep.
How commonly you see that the pain is due to muscle spasm or spine?
Yeah, most commonly it is due to muscle spasm on a general basis. But then I treat patients in a tertiary center. So I get more patients with disease in the spine. But in general, most pains are due to muscle-related issues, muscle weakness or poor posture.
So you're now, you told a very important thing about posture. Nowadays, like the use of mobile or desk. So what exactly people can do to avoid pain due to postural issues, especially people working in IT sector or the students studying? So what exactly they can do to avoid pain?
People who do jobs which involve sitting for long hours. So sitting places a lot of load on the lower back. So if you're sitting for long hours, it's really not good for the back. So if you're such a sort of job, see that while sitting, your back is properly supported. Okay. And you have armrest. Okay. So see that you have armrest so that you can lay your hands on. And if you're in such a sort of job, you should properly exercise your back muscles. So you should do your back strengthening exercises at least 3 to 4 times a week.
Sometimes I've seen one of my friend who was a software engineer and he started having back pain. Then he started seeing the videos of exercises which are specifically, sometimes we see the video on internet, some reels where they say that strengthen your back muscles with these exercises. Is it really advisable to do those particular exercises, or we should advise our patients to do strength training as a whole?
Yes, ideally speaking, they should do strength training as a whole. So they should be strengthening their back muscles, their core muscles, and everything.
Many a time, especially ladies, they do a lot of work in the home and like cooking or sweeping or the household chores basically. But commonly, even I have seen patients who are especially ladies in their 40s and 50s, they present with back pain. Do you see the similar kind of scenario?
Yes. We do get patients in their mid 40s, 50s. They come with back pain. It's
ladies.
Common. Yeah, it's quite common.
How ladies in their 40s and 50s can avoid back pain with their daily work? Because they do a lot of work.
Yes.
They don't find time to do exercise. So how should they?
Yes, all it takes for exercise is hardly 10 minutes a day for your back strengthening or core exercises. So 10 minutes a day is doing for yourself is not it's not a very big deal. So if you're working for the entire family for the entire day, so you should always you should be having time to take 10 minutes for yourself. It's just about priorities. And you should take care that you have adequate calcium and protein in the diet. So ladies usually neglect their diet. They try to cook for the entire family, and their diet becomes the last priority. So they should have proper healthy diet. So they should make sure that they have adequate protein in their diet and also adequate calcium in their diet. Because ladies after menopause, their calcium drastically comes down. So they should take care that they have a proper diet.
So what calcium or what supplements exactly you recommend for ladies?
If you are taking proper diet, then you really don't need supplements. But if your diet is not adequate, then you can take a daily calcium supplementation. You can take tablets.
Other than calcium, anything else?
And protein.
Protein. High protein diet kind of thing.
If not high, adequate protein diet.
Again, like people present with back pain due to injury, let us say a spine injury, they consult multiple doctors, and many a time it happens that some doctors say that your spine needs a surgery. Sometimes the same patient goes to another surgeon. He says that no, you don't need a surgery. Rather, you can do exercises or physiotherapy or rehab and recover. So, what is your take on that?
See, regarding injury, if there is a serious injury like a fracture or any ligamentous injury, okay, so we need to individualize these patients. So again, if there is any fracture with weakness of the legs, or if any compression on the nerves, then probably that would need a surgery. So the patient after injury is able to walk fine, if he's able to walk without any pain, or if he's able to move around, he has no weakness, then probably he would not need any surgery. He would heal with rest. And even with fractures, there are many fractures which heal on themselves. They don't need any surgery. So whether this needs surgery or doesn't need surgery is highly individualized. Depends on the type of fracture, the severity of bony injury.
So especially whenever they are very much symptomatic, especially like not able to get up or not able to bend down, not able to do their daily course, then and surgery is indicated, they must go for the surgery.
No, that also depends on the associate. We need to see the scans. We need to see the MRI scans or CT scan, and accordingly we will decide. It's a combination of symptoms and the scan as well.
How commonly you see mental burnout or the mental fatigue or the psychological issues being a cause for back pain?
Yeah. So they are not solely the cause, but they definitely hamper the interfere with the recovery. For example, if someone is he has a very positive outlook, he can recover faster. But with someone with a negative outlook, then his recovery would be delayed. Not that the healing of the tissues is delayed, but then his functional recovery is delayed. So it's very important that you are always in a positive frame of mind.
So people like many a times I have seen, like my father had a small fracture in the back, and then people have that in their mind that I have got a fracture. I should not move. I should not go. I should not do this exercise. I should not even go for a walk in the evening. So that is one of the major causes which is a reason for delayed kind of recovery.
See, what happens is whenever you have a problem or if you are injured, so it's a very common misconception that you should take rest, you should not move around. So once a patient is confined to home or a person is confined to home, so what happens is his say colleagues or relatives, they come to know about him and they start visiting him. They show sympathy on him. So and once say if your people are showing sympathy on you, you really start feeling like a patient. Okay. And you feel that something is wrong with me. These people come to see me and I should not. Then everyone who comes, they give their own advice. So now all these things, they have a very negative impact on the mind. So all these things go into your really deep into your mind, and you really feel that you are really a patient. And then even if your body is ready to say get back to work, your mind is not ready. So your mind delays your progress.
So how commonly even in our cancer treatment I have seen, if a patient gets a disease like cancer, the first thing is yes, patient relatives, they come and show their sympathy and most commonly they kind of give advices and which are out of the context and which are in fact harmful for the patient.
Yeah, many of them are harmful.
And what is the most common or most unusual kind of advice that some of your patients have come and told you that they have been advised by their attendants?
So it's a very they come with a very weird kind of advices. So for example, recently I had a patient of slip disc. So he was advised have goat milk. So
Have goat milk.
Goat milk. It'll cure your disease. And some people you go to some distant place for them some sort of massages. And recently I had a patient who had some massage with cow dung.
Acha.
Okay, massage with cow dung on his back. So you get all sorts of weird advices. Everyone who's coming, he gives his own advice.
Let us say people come to you after doing Google or Chat GPT about their back pain, and how commonly you see that thing, and does it really help them?
Yeah, off late this Googling has really increased. Now patients are coming, they come with a diagnosis. Okay, so diagnosis is my job. So they come with, sir, I have slip disc L34 and I have this thing, that thing. So Googling is, to some extent, it is good. It increases your awareness and it gives you some insight into your health or body. But depending on Google too much it's really harmful for the patient itself, because Google only gives responses based on your questions. You say, if you say I have back pain, it gives regarding back pain. Okay, but Google does not examine you. It does not physically see you. It does not physically examine your signs and symptoms. Okay, so what you think, say buttock pain or what you think back pain may not be back pain. Okay, so that is for the physician to decide. So Google is only, it could only help. But if you rely too much on Google, if you rely entirely on Google, that is definitely going to harm you.
In fact, I always tell people to doing Google or doing Chat GPT, it's kind of out of the syllabus thing. Like someone who is let us say, engineer, and he is doing a Chat GPT research on back pain. So he will get 10 different reasons why he is having the back pain, which may not actually in a way correlate to it. As you said, it could be helpful to some extent if at all we are not able to know. But otherwise, we should always do it with a pinch of salt and leave it to the doctor to decide on.
It's a doctor's job to diagnose. For example, in the 10 causes of back pain, one could be cancer. Definitely it will be cancer. So too much of Googling, too much of ChatGPT is definitely harmful to the patient.
Many a time we hear that alternative treatments options like Ayurveda, massages, or even as you said, some people try to go to some place and get some treatment done. In Odisha, we have some, they call it as some seko, like they give some kind of therapy to the leg and whatever the pain area. So like they will put it some hot coal or something, and then they'll start putting it on your body, and they call that it is causing the relief. How do you see that? Is it really advisable? Because people see that these alternative treatment options, they think that they have less side effects and they can be used comfortably rather than going for a medicine, because they want to avoid going for any allopathy medicines or any kind of surgeries. So how do you see this problem in your practice?
Sometimes it can be dangerous. Sometimes I've seen people having fractures of the spine because of these forceful massages, forceful manipulations. So if your, say, bones are osteoporotic, if your bones are weak, these forceful massages and forceful manipulations can really fracture your bones.
When can we know that our bone is weak?
So physically weak, it's really tough to know unless you...
When I'm asking from a common man's perspective, when can he realize or understand that, yes, my work, because everyone who gets pain will feel that, yes, I'm getting weak or something like that, or my bones are weak. And many people will go for the scans like the DEXA scan and all that. So what is the common sign that we can tell people, yes, this is the thing that you should go for a test to see that your bones are like osteoporotic or brittle or weak kind of?
See, the most definitive sign for weak bones or osteoporosis. So, for example, if a middle-aged or young boy, if he say slips and falls in his house, there won't be any fracture. But if say a trivial injury like a slip and you fall in your house itself, if it causes fracture, which means that your bones are definitely weak. So it's a definite sign of osteoporosis. And you should get treated for the fracture, not only for the fracture, but for the osteoporosis as well. Other than that, you may be having back pain, some vague pains during the normal course of activity. So that is also a subtle sign that your bones and muscles are weak.
So do certain times we get like back pain, and it is like some not back pain. Let us say certain times people get some injuries. Okay, injuries in the sense. Let us say take the example of Rishabh Pant.
Yeah.
So who had a very severe
Ligamentous injury of his knee.
and
Very bad
see the mental strength for which he has come back, and now he is playing for the country. So how often you see that kind of personalities who undergo such kind of like problems? What is your advice if someone is having a big injury, let us say road traffic accident, and he has to come back?
Yeah, definitely. As I was earlier told, should always be in a positive frame of mind. So now medical technology, medical science has advanced so much that any patient, for every serious injury, there is always a better route. You can always get better, no matter how severe the injury is. You may not be able to reach your, say, 100% fitness, but there's definitely a way to get better. And the more positive you are, the more better you will get. The best example, of course, is Rishabh Pant. He had a very serious multiligamentous injury. And the healing probably would be the same in either Rishabh Pant or anyone else. But because of his mental toughness, because of his positive attitude, he came back to playing professional cricket. So mental toughness, positive outlook definitely has a big role in recovery.
So rehabilitation, as we are talking about rehabilitation or physiotherapy. So how important is physiotherapy for any kind of recovery? And commonly, I see as sports person, like we are many a time misled by physiotherapy, like giving some kind of muscle, stimulants or something like that. So what exactly?
Stimulants, you mean drugs?
Not drugs. They will put some kind of, it will have some muscle twitching kind of
electric
stimulation thing. So how commonly it is useful? How should we go for it? Because I found that we didn't see the benefit with that, rather it delays the healing.
So for any person who is recovering after injury, physiotherapy has a definite role, and he should be undergoing physiotherapy because it reduces stiffness, improves his range of motion, it gets back to his previous muscle strength. But there are some practices which some people follow. They are totally unscientific, and they tend to say cash on the patient's weakness, some fancy treatments. These are all unscientific and they really don't work. But as you said, electric stimulation works when the muscle power is really weak. For example, in paralysis patients, it may work to some extent, but not in every case.
But overall, physiotherapy is very important,
Definitely,
especially after any kind of bone injury or muscle injury.
Any bone injury or any muscle injury, physiotherapy rehab is of utmost importance.
So, what is the most common myth that you see or you encounter during your practice about back pain?
The most common thing is rest. So people say rest for say if they really come and they ask for a certificate, give me rest, and they really take rest. They take rest for 2 weeks, 3 weeks. Scientifically speaking, there is no role of rest more than 3 to 4 days. Okay, and the rest is usually required in the acute phase. So it usually lasts for about 3 to 4 days or maximum a week. So what happens if you take rest for more than a week? Your muscles will become weak because they are not activated. Your bones will become weak, and psychologically also you'll be going down.
As you said that people feel that running or doing certain kind of exercises, they will hurt their knee. So how runners or anyone doing any kind of like walking on the road, many a time people say that you don't walk on the road, walk on the kind of side or sand where less impact on the knee will be there. So how exactly you see as a doctor and avoid or advise the patient?
Yeah, many people they come with telling that running is really harmful for the knees, and even they advise me not to run on the road. See, running actually activates your thigh muscles, the quadriceps and the hamstrings. Okay, and running is really beneficial to the knee. It improves your cartilage, and there are studies also which say that running to about 25 kilometers a week is really harmful to the cartilage. Running on the road it has a impact. The reaction force is more. So, but then if you are wearing proper footwear, that can be negotiated.
And also the strengthening and strengthening our glutes, our
Yes.
hamstrings,
Strengthening your leg muscles.
leg muscles. So that will put less strain
So
on the
that
knee
will,
joint
that will bypass your knee. It will put less load on your knee.
and also back the core muscles. Because many people who start running, they really don't do the strength training. And that is the reason why they get
all this pain.
knee pain or back pain and all that. So strength training is very
Strength training
important.
of the entire body is very important if you are into physical activity.
And before we end, tell me one habit that you would suggest our viewers that they should do in order to avoid back pain in their late 40s or 50s.
Yeah. Avoiding probably is not possible, but then you can reduce the incidence or reduce the severity of pain or reduce the frequency of pain. There is not one activity, but say 3 or 4 activities. So one is maintain our ideal body weight. So again, to maintain weight, it's a combination of diet and exercise. You should. I'm not telling you to skip anything, but have mindful eating, do regular physical exercise, and it should be a combination of say cardio and strength training as well. So only one is not really good. So only walking is not good. So you should do a combination of say cardio, walking, running, and some weights as well. And coming to maintain proper posture. And one habit which really harms the back is smoking. What smoking does?
How exactly smoking affects the back?
So smoking is proven to accelerate the wear and tear process, the disc degeneration in the spine. Okay, they gradually degenerate over a period of time. So, for example, after 50, your discs become dehydrated. They lose their function of shock absorbing. But then, if you're a smoker, the changes which are supposed to happen at say 50 years, they show up in your back at 25 years. So, smoking is one proven cause of accelerated disc degeneration. So, smoking is really bad for the back.
Is dehydration or drinking less water or alcoholism, they also cause back pain?
They're not clinically proven to cause any back pain. Okay, and they're not. Drinking is obviously not good, but then it's not directly related to back.
Drinking less water.
Less water is also not directly, but you get that muscle fatigue. If you are dehydrated, your muscles start aching soon. So you tend to get dragging sensation of your back, weakness of your back. So it's important to be properly hydrated throughout the day.
Thank you, Dr. Leela. And so, friends, we could understand. Yes, back pain is a very common problem. We cannot avoid that, but we can definitely fight it out by doing proper exercise, strengthening our muscles. Don't go for the rinse and do just single or only back muscle exercises like that. We should go for complete a proper strengthening training schedule under the guidance of a trainer. We should do exercises on a gradual basis rather than jumping around and going for a very high-end exercise which is unaccustomed. Rather, we should gradually increase our exercise and reach a particular level which will help us to strengthen our muscles and our bones and maintain a proper body weight with proper diet. Thank you very much for watching till the end, and if you like it, please do subscribe and also share it with your friends and family.